information on prevention, tools for a healthy lifestyle. Make little changes to be the best you. It's all here. A podcast empowering, informing, and motivating Bermuda to live well. Bermuda Health-Abets. Everything from A to Z on healthy living. Brought to you by the Health Promotion and Wellness Office of the Department of Health in collaboration with local health partners.
Welcome to an episode of Bermuda Health-Abets, a podcast where we discuss everything from A to Z on healthy living with a mission of empowering, informing, motivating Bermuda residents. I'm your host, Dr. Veloy Lewin, Health Promotion and Wellness Coordinator, and our guests on this episode are Dr. Donna Outerbridge and Riccal Walls, Community Health Social Workers. Welcome, ladies.
Good morning. Welcome. I'm saying welcome. Thank you for having us. Yes.
So today we're going to be discussing about caring for our mental health. But before we get into that topic, just tell us a little bit about yourself and your role.
Our role, my name is Dr. Donna Outerbridge, and my role is Community Health Social Worker, and I work with Riccal, who's another Community Health Social Worker. What we basically do, we help anyone within the community, whether it means connecting them to resources, helping them to fill out application forms, and it's from all ages in the community. We do office visits, home visits, etc. Riccal, would you like to add to that?
Sure. Again, I'm Riccal Walls. Hello, everyone. I am a community health social worker with Donna, and we primarily connect people to resources and offer that support, whether it's the social emotional support or connect for financial resources. We just try to be a supportive body in the community for persons walking in or just calling in or who are connected already to Department of Health services.
Great. Well, thank you. Thank you for sharing that. So we're talking about caring for your mental health. And I think it's a real timely subject right now here in Bermuda. My first question is, how can I take care of my mental health? What do I need to do to take care of my mental health?
Well, one of the things that we would suggest would be mindfulness. Being mindful about how you're feeling in that moment with no judgment, taking time to relax, using techniques like reflecting on how you're feeling. Why am I feeling this way? Even writing about it, grounding yourself in the deep breathing, and just taking time to be present in that moment. And another part of it would be spending time with family and friends, being able to be around people that are positive, who you can have positive support, who you can talk to, who you feel comfortable with. Just making those positive social connections.
And I think it's also important for us to slow down. We're very busy people, and we're always running from this thing to that thing. We have work, we have we're doing a lot as people. Mm-hmm. So sometimes just slowing it down and, like Donna said, just finding time to relax and slow down and deep breathe and ground yourself, I think is important.
I think the mindfulness thing, because a lot of times we don't take the time to reflect or to take, as you said, that quiet time and slow down. I'm listening to what you're saying, and I'm like, do I have time for this? Really? I mean, it sounds good, but do I really, how can I practically, give me, I guess, an example of how you would, if you're in a situation, what would you do to put one of these into practice?
We're so excited about the topic. I know for myself, I can speak to journaling. That's been a really big thing for me. I carve out time every morning where I sit down and I really reflect on my thoughts. And it's a good way to then look back and say, okay, look, I was feeling this way for a period of time, and now you can actually track, your progress if you are trying to get to a certain place, I guess, mentally. But just releasing the thoughts from your head. Sometimes when we think, I got to do this, I got to do that, or this is bothering me, or this is, and it just builds up mentally. When you release it, like journaling, like I said, is a good example of taking it from your head onto paper and kind of doing it as a release.
Go ahead.
And for me, I take time to take deep breaths. I think about it. If I feel upset about something, I just slow it down. Rather than reacting in that emotional state, I slow it down. And process, okay, why am I feeling upset? Did I misread the situation? Just kind of think about it, slowing it down like that. So when I respond, I'm not responding from an emotive standpoint. So I do that on a regular. I do a lot of self-talk because, things can happen. You're like, okay, do I want to respond? No, this is not going to be a good thing. I do the whole Sesame Street thing. If I did this, what's going to happen? So that helps me to slow down my reaction to my emotions.
And that takes practice, right? It's not something you get overnight. So yeah, I can relate to the journaling. I was looking at something I had written a few years ago when I was going through something. I was like, wow. I mean, seeing where I was and where I've come now. So it does, show you your progress at least, because you don't think about it. I mean, once it happens and it goes away, if you don't have it written down, you don't see kind of like the progress. So I really like that. So when should I seek professional help? If I trying to do all of these things, but things are still not working well for me, when should I seek?
Yeah. I was going to say that there are different signs and symptoms that come up that would help you identify that there's a challenge or that you may be struggling. Like you may have changes in your sleep pattern. You might not be sleeping as long or as often, or it could be the opposite. You're sleeping too much, oversleeping. Changes in your diet, your appetite. You're not eating or you're overeating. Not enjoying the things that you used to enjoy.
Isolation.
Yeah, isolation is a big one, just wanting to be by yourself. Now, don't confuse that because sometimes, like me, I enjoy a little me time.
Me time, of course, I understand.
But, if it's to a point where you cannot be around people and, you're finding yourself, like isolation is an indicator as well. So there are the different signs and symptoms for when you should probably consider professional help.
And if you show up, if you're normally a person that's meticulous about how you dress and how you present, if that changes, that's a sign as well that something's not going well.
So are there differences in the way mental distress shows up in children than adults, or is it the same?
It can show up differently. Children, it can show up if them acting out in class and, just getting into fights with other classmates. It just shows up differently.
And sometimes it might be less overt symptoms, like or less obvious things. It could be things like, my stomach hurts, I don't want to go to school today, I don't feel so good, or you're just becoming a bit more withdrawn, or you're seeing that isolation again, what you mentioned with adults, seeing like with children. So you have that aggressive piece that might show up as the fighting and aggressive behaviors. Then it can also, like I was saying, show up as more somatic symptoms of like tummy aches or feeling unwell, not wanting to go to school, not wanting to engage with their peers or do the activities that they were doing before, or isolating themselves.
So is that like over a period of time? Because, kids can do those things and want to get out of going to school. So is it like something that you see recurring, or is there a period of time that you should like, okay, let's watch it and see what's going on and then kind of seek help?
I would gently suggest just having that ongoing connection, building that relationship with your child. So when something is a little off, you can notice it, or the child might come and say, Mom or Dad, this is how I'm feeling. It's so important to have that strong connection, or build that connection and have that open communication with your children so that you can be there for them when something may go wrong or something may have happened, so they feel comfortable.
Right.
And I'll share one of the things that I started. I think I was actually telling a co-worker of mine about this. When it comes to the journaling, I actually started a little journal for my daughter and I. So she's 9, and so I would write something in there and just leave it, on the nightstand. So I told her whenever she wants to write down something or tell me something that she doesn't feel comfortable, like verbally discussing with me, she can write it in the book, and then we can write back and forth. So that's just another little tip, I guess, you can offer. as a parent, or if you have a young person, because sometimes children don't want to talk.
Right.
So
right,
you know, it's another option too.
I like that. Yeah,
Yeah,
that's a great
that's
idea.
nice.
I like
Right.
that. Yeah. Okay. So, how can I find help? Are there resources in the community that I could, um, find help for what I need?
Yes, there's resources both in the public sector and in the private sector. We have a few lists here.
Yeah, so the one that stands out immediately would be MWI, or Mid-Atlantic Wellness Institute, that is psychiatric hospital. So they do have a crisis hotline. I think it's 239-1111. So that's for MWI. Then there's also Women's Resource Center, the Family Center. They offer counseling as well. Bermuda Red Cross, they offer supportive services also.
And EAP.
Yes,
Yes.
EAP, the Employee Assistance Program. It's a
Right.
mouthful, but if your employer is connected with that program, then they would offer counseling under that partnership. And then you have the private organizations like Solstice, for instance, where they have several different psychologists that you can schedule an appointment with, and then go and speak with someone to hopefully get that mental emotional support.
And Banner Association, you have Family Intimacy Center, Synergy, Milestones. There's a list of private counseling places that you can go to, but it's for a fee.
Right. Yeah. So there are the private ones and those that are free
Right.
of charge. Okay. So I think we have put that listing on our Department of Health Facebook page, so people can go and access and see the free resources as well as those that are paid. Or does insurance cover some of that? Or
Some in cover, for some that I've checked, Future Care and HIP does not cover.
Does not
I
cover.
mean, HIP may be covered a minimum sessions. No, sorry, Future Care covers the minimum sessions, but yeah, they can check with, if they have insurance, check with the insurance providers to see if they cover for counseling services.
So what would you suggest, I mean, for people who may have noticed their family members or something's different about them, how would you suggest they approach or try to help or find assistance for them if someone you notice a family member is not doing well? I mean, sometimes people are in denial too, right? So how do you navigate that? It's very ticklish to.
Yeah, I would suggest approaching them from a non-judgmental standpoint, being empathetic and listen, and not offer immediate, okay, you should do this, you should do that. Really listen to what that individual is saying, so you clearly hear what their concerns are, so they feel heard. Oftentimes, people feel unheard, so they probably won't talk to someone because they want to be judged, or someone saying, oh, you shouldn't feel that way, or, this is what you should do. But just really be present, open, and willing to listen to someone who's coming to you to talk.
Go ahead.
Yeah, I agree with that. And also, in addition to having the space, being comfortable sometimes, feeling uncomfortable, I think is important. So if someone is sharing, like Donna said, like not just jumping into trying to solve or fix a problem, just allowing that person to speak freely and letting them know that you're there for them. And it's helpful to know what the community resources are so that you can direct them. You can also suggest going with them. Like if it's, I know this could be scary, I would go with you if you want someone to be with you when you go to talk to somebody. Just kind of being there for the person, I think, is important. And recognizing those signs and symptoms within yourself, but also with other people. So if you're noticing, like you said, changes with those around you, being comfortable to bring that up.
Right. Now I know, Riccal, you are a mental health first aid instructor.
I am.
And Donna, you trained for the youth mental health first aid instructor. So how would you recommend people take those courses as a
Absolutely.
Yeah?
I think we're just jumping in with that answer because I find it very, very important. And it's not to say we're trying to, create therapists and counselors around the island, you know,
right.
but it is, I think, important if we can know what to do in that those first moments of someone having, you know, mental health challenges or crisis in that moment, being able to be there and connect them could be essential. Just like the physical first aid,
Right.
CPR first aid that, you know, everyone gets trained in. If we build those tools and those skills from a mental health standpoint, I think we can move in a stronger, healthier community.
Yeah.
I agree.
Yeah. I've heard the saying, there's no physical health without mental health. I think that's the saying, yeah. So they all kind of complement each other and are necessary. So I don't know if you have any other thoughts that you want to share with us, the audience today. As we're talking about caring, I know caring for our mental health. There's so many areas, but is there anything that you want to leave with our audience today?
Just to be very mindful of that in self-care, understanding that's important, taking the time, not saying, oh, I'm so busy, I don't have the time. You really do need to pause and take the time to take care of your mental health well-being. And I just think that that's something that I would like to emphasize, self-care.
Yeah.
Yeah. Gosh, can't top that, Donna. That's a good one. Self-care is good. And with self-care, I also think taking care of yourself, you know, they have that saying, treat others how you would yourself. I almost feel like for us in community, it's the opposite. It's like, treat yourself how you would someone else. Because we are very kind to other people, but sometimes we could be a little unkind with ourselves. So having that grace with yourself and that compassion for yourself, I think is important.
Yeah.
Wonderful. Thank you so much for being with us today. We appreciate you both for the topic on caring for our mental health, which is a very, very important aspect of our lives. So I want to thank you for listening to another episode of Health-Abets, where we discuss everything from A to Z on healthy living. Continue to follow us on Department of Health Facebook page for our next episode. See you later. Thank you.
You have been listening to Bermuda Health-Abets. Please note, anything you heard on this podcast is not a substitute for visiting your healthcare provider. If you have a topic or want a question answered, please contact the Health Promotion and Wellness Office of the Department of Health by emailing healthpromotion@gov.bm or by calling 278-4900. Be sure to listen out for the next episode of Bermuda Health-Abets.